We'll turn now to Tarun Khanna, who is the Jorge Paulo Limon Professor at the Harvard Business School. He is also the director of the South Asia Initiative here at Harvard University, and he's the author of a book entitled Billions of Entrepreneurs, How China and India Are Reshaping Their Futures and Yours. Tarun, do you want to stay seated, or would you rather? Okay, great.
Thank you, Liz, and thanks to Prasanjit and Yashing for provocative comments. I thought what I would do is, in the interest of opening it up, is just talk about 2 or 3 personal involvements over the last 10, 15 years that I believe have some general points to make. It's probably easier to make the points through the examples rather than through statistics. I can give you statistics if that's of anybody's interest. There are two sort of, one of the preceding commentators spoke about technology and the importance of, I think Prasanjit alluded to it. There are a couple of these efforts that I've been very involved with. One was referenced, Aadhaar, the unique biometric ID, and the other is a medical example. So I'll start with the medical example, give you some things to think about, raise some general issues, move to the biometric ID, draw some parallels between them, and then offer some involvement, offer some observations from my own involvements with organizations in rural China over the last 10, 15 years, where I've had a fiduciary responsibility, so it's somewhat personal. And I'll tell you what I generalize, and that may be an inappropriate generalization, so I'm happy to put it out for consumption and see what people have to say. So the first is a heart hospital that I've played a role in shaping for the last 10 years. It's called Narayan Heart Hospital. Some of you may have heard me speak about it before. I continue to learn endlessly from the heart surgeon who runs it, a gentleman named Devi Shetty. The hospital was founded in the early 2000s, and it's grown to be a fairly massive, it's the largest heart hospital in the world by far in Bangalore. It also has the largest oncology center, the largest eye hospital, the largest this, the largest that, all next to it. They're just large because there are a lot of sick people, and there are a lot of sick people because there are a lot of people. So there's no magic here in why it's large. But the particularly interesting, I've engaged with some PhD students in getting data on heart surgery productivity, and I'll offer you this one particular controlled statistic for something called a CABG surgery, which is coronary artery bypass graft. Most common type of bypass surgery that people undergo around the world. That surgery, which is essentially bypassing your clogged arteries, which you get for bad diet or genetics or what have you, today in Mass General probably costs, I'm just using Mass General as a placeholder for most tertiary U.S. hospitals, probably costs $100,000 fully loaded. Medicare reimbursement is much less than that, $60,000, $70,000. So that surgery in Narayan Heart Hospital costs $1,300 today. So it's $1,300 versus $100,000, $120,000. So 1%, give or take, of the cost. The mortality numbers for the same surgery with the same equipment, cutting edge, state-of-the-art equipment, I'd argue more cutting edge perhaps in some ways in Bangalore than in Boston. The mortality rates are comparable, statistically comparable. In other words, the number of people who fall over dead in a predefined time is the order of 1.5% in both places. But the number in India, which is 1% of the cost, so that's a productivity control cost, if you will. It's normalizing for productivity and normalizing for quality, if you will, of heart care. The Indian numbers, I think, are much more impressive. So I'm using this as an example, as an isolated example of technological developments that are interesting, that are coming out of the ambiance of India. And the thing to focus on is, why is this coming out of technological backwater in general that continues to be India? That's the general issue that I think I'd like people to focus on. But those numbers are achieved with a patient pool that's monumentally more complex than the patient pool in the US. So it's not the case that it's easier surgeries. It's monumentally more complex for a variety of reasons having to do with poverty, ignorance, genetic structure, et cetera, et cetera. Indians, it may dismay those of us who are brown skinned in the room to know, are amongst the recipients of the worst genetic lottery for cardiovascular disease. And that's part of the reason. So when you compound genetic bad draw with poverty, ignorance, malnutrition, et cetera, you get the worst heart patients in the world. So despite that, these numbers are better. And these numbers include the fact that 40 to 50% of patients are treated not quite for free, but close. right? So that's fully loaded into this cost structure. So I think you get the drift. Even if I'm exaggerating, and the data that I've seen are doctored, or the entire experiment is somehow doctored, it would have to be doctored by a full order of magnitude at least. So I think the thing that's happening is somehow it's possible in a morass of rubbish to create an island of excellence. The need is so great. The need is so great, and the opportunity for an entrepreneur to come in and cater to such a dramatically large need is quite large. And I've seen this happen over and over again the last 10 years from my own students at Harvard or MIT, mostly, or in the Boston area, who have decided that they found some place where there was a big opportunity, and they ran that all the way to the technological frontier, and incidentally to the bank as well, but really more to the technological frontier. The puzzle for me is that why doesn't that happen much more often, or what can we do to get it happen much more often? And I think Yasheng's admonition is exactly right, which is that if we had a primary education system that was turbocharging the base of it, you would see it catalyze and grow. And that's why, you know, Devesh and other people's work on education with Pratap Mehta and others is also sort of really, really important. That's exactly where the missing investment is. But the first thing I learned from that heart hospital example, and hopefully that grabs people's attention, is that technological leapfrogging is not only possible, it's happening. I wish it would happen tenfold more, because it would help the people of poor countries as well as the people of the world. But it's happening in a whole host of areas, and we can mention some other examples if time passes. The second thing that Shetty's example, the surgeon's example, suggests to us is that it is an example of private sector initiative. It's somebody doing this off his own accord. But it is not one that I would care to characterize as private sector versus the state. In fact, I think one of the coolest things about this example is that Shetty has managed to free ride on the existing underutilized public investments of the state. So I'll give you a couple of examples. Prior to this hospital being built, there was a massive, fairly corrupt building boom in all over India. And that got translated into buildings of large numbers of hospitals because the state, I believe, I'm not sure about this, was giving out free land to build hospitals. And a lot of industrialists got involved, grabbed the free land, made a lot of money doing it. But the hospital buildings essentially sat around half utilized, if that, and decrepit state and so on. So this gentleman's entrepreneurship is not just in the cutting edge of heart surgery. I believe he's one of the best pediatric heart surgeons himself today in the world. But it's not just in the science and the technology of delivering it. It's in realizing that there are investments that, in the interest of society and his enterprise, he can free ride on that are just sitting around doing nothing. So he created an insurance scheme with the blessing of the state to say, let me use your underutilized or unutilized free capacity in a productive fashion. And that's allowed literally millions of people to have access to tertiary care at cents on the dollar in some sense. So that's an example of this not being the private sector versus the state. I think that's a silly dichotomy. It's really one where the two are used judiciously and in concert to do something productive. A second example would be, through this particular hospital, there is now the infrastructure to provide free telemedicine for tertiary care of almost any kind of tertiary care. Well, that's overstating it. Many kinds of tertiary care to all 53 African capitals around the world. Right? So if you are in an African capital city and your government decides to play ball with the Indian government, you can, in fact, designate a couple of hospitals where anybody can walk in for free, say, these are the images that I have. You connect to a leading tertiary surgeon in one of 10 hospitals in India now, and you get a free diagnosis. It's a humanitarian gesture, but it turns out to be actually quite cheap to do it from the standpoint of the entrepreneur, because again, there's, we love to lob, if you look at the papers the last 10 years with the North Korean launch of the satellite, and the Indians doing it, and the Pakistanis doing it, and the lists of everybody who's capable of doing satellite launches and so on. The thing that's under-mentioned, if mentioned at all, is that most of the available technological capacity that's floating in the, not even in the ether, but beyond, is unused. It's just sitting there. And so you can use that satellite capacity to transmit images for free, essentially, without really compromising the security, national security of any country. And that's the free asset, just like the unused hospital capacity that they've relied on to do free telemedicine to essentially all over rural India at this point, rural Southeast Asia, and now at least in 5 or 6 African countries to regularly diagnose patients for free. So the point I want to make is that there's technological leapfrogging happening in a general technological backwater. And the way it's been pulled off is through clever utilization of the state harnessed to entrepreneurial energies. And my own assessment and intuition is, I think, consistent with that of some others here on this panel and the next, is that I think the primary barrier holding that back is just ambient educational infrastructure that would allow other people to insert themselves into this engine of progress. Let me quickly move to the second. The second is called Aadhaar. Aadhaar, which in Hindi means, or Sanskrit means foundation. And the idea is that most of the, Prasenjit alluded to something awkwardly called NREGA, which is, what is it? National Rural
Employment Guarantee
something scheme. Okay, yeah. So there's a lot of people here who know better, but essentially it's ACT. So it's basically, as you said, a big Keynesian infusion into the economy to say, let's make guaranteed employment available to just about every Indian. It's generated employment, etc. Prasenjit's articulation was somewhat more positive in passing. On another day, we'll contest that. But even so, that's neither here nor there. The point is that NREGA is there. But the point I want to make is that NREGA actually sort of doesn't really work in the best way that it's meant to work. It's meant to empower the most disenfranchised, who are typically the women, the poorest women. And even a poor woman who goes and partakes of this rural guaranteed employment doesn't actually get the money coming to her. Right? The money is taken by typically some man who's floating around and who grabs the money and runs. So that's a nice, simple example of something that, even with the best intent, even if you think it's conceptually not flawed, and you have the best intent of helping a lot of people who are disenfranchised, the delivery is not possible currently because the infrastructure doesn't exist. I think a nice way to capture the statistic is that even though the law in India says that every child has to have a birth certificate, I think the percentage of people having birth certificates is just about 50%, 52%, 53%, right? So the law isn't observed. So most citizens have no way of proving that they are citizens or resident or what have you. And in that circumstance, delivery of services is essentially impossible. Now, what this biometric ID does is a very audacious experiment that a gentleman who's known to many people in this room, Nandan Nilekani, has helped, a software entrepreneur himself, has helped to catalyze and to say, let's try to leapfrog and do this in a very ambitious way so that all 1.2 billion people in India, or anybody resident in India, gets a unique biometric ID. So that for the first time in the world, and this is not possible in India today, in the US today, it's not possible in China today, it's not possible anywhere in the world, that you can in real time verify that the person who is engaging in a particular event or transaction can in real time be authenticated. So right now, think about when you use your credit card and Visa authenticates your credit card, it's authenticating the card, not authenticating you. It has no way to tell, even if you have a smart chip in it, unless the smart chip is connected to you or you have a thumbprint reader with it, there isn't really that match of real-time authentication. So here the idea is that 1.2 billion people will be instantly authenticated once the infrastructure is in place. Now, it's still an aspiration, but I think with 200 million people getting the ID, it's already twice the size of the next biggest biometric database in the world, which is the FBI Homeland Security database, about 80 million people. And I think in a couple of years, it'll be 5 times bigger. Now, the reason I'm very optimistic about this, despite much skepticism and naysaying, is that when I look at my students who tend to be the entrepreneurial types, they're not waiting for the success of Aadhaar. They're assuming that Aadhaar will exist. And they're busy building businesses rapidly and raising funds rapidly to plan for when the infrastructure exists so that they can build ecosystems on top of this to run with it. And I think that is what will trigger. Now, the challenge for India, the albatross around India's neck is, sorry to be repetitive, no education. Right? There's just no education in the rural areas. Without that, it's very hard for anybody to, if you find something taking off in an economy where things generally don't work, what you want to do is allow every person, particularly every young person, to be able to put a lifeline onto that thing that's moving and grab onto it and run with it so that they can all be moved forward. And that's missing. I have my 1-minute mark, so I will stop and let's open it up. Thank you very much.